I am Sarah Laird, and I am a nuclear medicine technologist at Spectrum Health Ludington Hospital. I have worked here since 2003. I graduated from Ferris in 2001. Ferris is actually the only accredited program in Michigan.
What is nuclear medicine?
Most of the tests that we do in nuclear medicine are based on the body's function, not just what does it look like. So there are other imaging modalities that are great at those very detailed pictures and can see down to the millimeter, what's wrong with someone. But if it doesn't look wrong, then that still doesn't mean that it works right. And that's where nuclear medicine comes in. I have to know what it looks like, but I also have to know how it works. Nuclear uses nuclear tracers to highlight different parts of the body and look at how they work. Somehow our tracer works with the function of that organ in order to get there. So if I want to know how well somebody's kidneys are working, we give an injection of a tracer called MAG3. It's specifically designed to go to the kidneys, and it is radioactive, and our cameras work just like big Geiger counters. All the cameras can do is detect radiation, but they can also quantify the radiation too. They can tell how much is where. So we give the injection and we take pictures, and then using computer programs, we're actually able to tell how much of our tracer was absorbed into the right kidney versus the left kidney over the next 20 minutes. How well did the right kidney empty versus the left kidney? Are both kidneys emptying the way that they're supposed to? Or is there a blockage that's preventing one of the kidneys from emptying the way that it's supposed to? Using computer programming, we're actually able to quantify the pictures, not just visually look at them. We do a lot of stress tests for cardiac patients. We do a lot of bone scans. It's a normal bone scan right next to an abnormal bone scan. And so you can see the abnormal one has we call them hot spots. It's speckles all over the skeletal. And that's what cancer looks like on a bone scan.
What is one thing you like about your career?
Our tests can take hours. So it's not like an x-ray where you just come in and get your picture taken and you're back out the door, which is one of the things I do kind of like about nuclear. I get to spend time with my patients. I get to make a connection with my patients. They're with me for sometimes 3 or 4 hours. And so you do have longer to make a connection and talk to patients. For our facility, 5 patients a day is considered a full schedule. And so that may be 5 stress tests. It may be 3 stress tests and 2 bone scans, but they just worked it out that on average, 5 patients a day for 2 techs at our facility would be a full day. In Grand Rapids, it's going to be much different because they have multiple cameras. So they may have, I think they have like 3 or 4 cameras in their department. So you could probably multiply what we do by 3 or 4 for what they do for a day. But I like that I get to spend a little extra time with my patients, being that we do bone scans, like I was talking about before. Oncology patients come back. Sometimes I have a patient that I see every 3 to 6 months. She gets a repeat bone scan with me. When I call her to remind her, it's like old friends chatting. I look forward to seeing her on my schedule. Like, I don't like that she has to come in for testing, but I'm happy that I get to be the one to take care of her and that I know I'm going to make the trip in for her enjoyable. So the connection with my patients is probably, besides being the anatomy and physiology junkie, I like being able to make something that people don't enjoy more enjoyable.
What is the work schedule like?
The materials we use have a very short half-life. Every 6 hours, no matter what we do, half of our tracer's gone, which is good for patients. It really decreases the amount of radiation that they receive from having one of our tests because every 6 hours, they're half as radioactive as they were. That is great, but that means that we have to get a delivery every morning because what I get today isn't going to be still good tomorrow. So our first tech comes in at 6:30, and then the second tech comes in at 7:45. And we work typically 8-hour days. We are not on call after hours, which is great. We used to be, but we are not anymore. So whether there's call involved with the job is definitely just job dependent. If you worked at the hospital in Grand Rapids, they take call every night. They actually have second shift as well. We're far enough away from the radio pharmacy that I don't have the material to do the testing after hours. It's not an option here. We work typically Monday through Friday, but again, in Grand Rapids, they cover the weekend shifts too. So whether it be on call or just staffed on the weekends. So we've got it a little cushy up here. And I'm very grateful because I have two beautiful daughters and they're very active in sports and activities, and not having to take call anymore makes for a much better quality of life, which is important. Those are things you want to think about when you're picking a career. You don't want to miss out on life.
What was your career path like?
I grew up in Ludington, Michigan, and I went to, O.J. DeYoung Junior High. In middle school, I always loved science, but I didn't really know that that's what I wanted to do in the future until I got into high school and took that anatomy and physiology class, and something just clicked. I signed up for the allied health program. And in doing the allied health program, we were able to go and do job shadowing at a nursing home. And then we're also able to go to the hospital into all the different departments. And because anatomy and physiology was my favorite, and that played well into the radiology department, I went through every imaging modality: CAT scan, MRI, ultrasound, X-ray, and finally nuclear medicine. I also got to spend time with radiologists and see what they do every day, and came to realize that being a radiologist was not in the cards for me. And so in going through all of the other imaging modalities, I was able to realize that nuclear medicine is the one imaging modality that uses both anatomy and physiology. When I was able to decide that's what I wanted to do, I got it set up pretty much right away so that when I started at Ferris, I got right into the nuclear program. At the time, it was an associate's degree. It was 5 semesters, but it was an associate's degree. So we had a summer semester essentially after your first year of college. And then the whole last year, the last 2 semesters were all internship. So I actually did my internship in Battle Creek. The hospital there was really nice, but Battle Creek is not Ludington. You can't trade our beach and our state park and kind of just that small town feel. I married my high school sweetheart, and so he was from here too. And just growing up here, we knew we wanted to come back. As soon as a job came available here after graduation, it was after we had gotten married, we were able to come back home.
What skills are needed for this career?
I don't get to read the studies. That is either a radiologist for most of our general studies and a cardiologist for our stress tests. Most of the time, do I know what I'm looking at? Do I know what the exam shows? I do. But the liability of me saying something to a patient, you just can't. And sometimes it is extremely hard when you get a patient in there and they're getting their initial workup because they've been diagnosed with cancer, and I do their scan and I know it's spread. I have to smile and walk the patient out the door and act like nothing's wrong. And that's really hard. I think you have to be a people person to want to work in medical imaging. We see people sometimes at their worst. No one wants to be at the hospital at all. And sometimes they can take that out on you. And you have to just kind of compartmentalize that and realize, it's not you they're mad at, it's the situation. And you have to be able to be in the position where you can handle putting that smile on your face. Multitasking is definitely a plus. When I have a patient who's getting a scan, I may be chart prepping another chart for the following day. And with our tests taking so long, sometimes I have 3 patients all there at once in different parts of their scan. And so, like for a stress test, we give an injection, they have to wait a half hour to let the medicine get to the heart, and then we take a set of images. Well, in that half-hour wait time, I might be getting a different stress test started. So kind of juggling the schedule and making sure that you're detail-oriented and can keep track of, obviously anything in medicine, details matter. When I'm giving somebody a dose of radioactivity, I can't just say, oh, it's about 15 millicuries. We're going to call that good. I have to mark it down to the decimal, exactly how much I'm giving somebody.
What advice would you give to students?
Find a way to get some experience in the real world, even if it's just shadowing, even if it's just one day, so that you do have an idea of what the actual job looks like. So I feel like if students take the time to find something that fits with what they enjoy, work isn't so much work. I'm okay going to work every day because I like what I do. So it doesn't feel so much like work.
What is one new thing you learned about this career? What is one thing that inspired you from watching this career chat? Which of the statements is true? A. Sarah loved science when she was in middle school. B. Sarah wanted to return to Ludington after she got her degree. C. Sarah participated in the Allied Health program in high school. D. All statements are true. The answer is D. All statements are true. True or false? Nuclear medicine is the one imaging modality that focuses on what the body part looks like and how it is functioning. The answer is true. Nuclear medicine is the one imaging modality that focuses on what the body part looks like and how it is functioning. What would Sarah's job look like if she were working in a bigger city like Grand Rapids?